I'm going to kind of combine a couple because they're kind of a similar vein here. But so if a kid has already had COVID, do they still need the vaccine? What's the like the immunity difference, I guess, between having just the infection versus the vaccine, or both? And then do we kind of see this as vaccinating this age group as a way to kind of reach a so-called end of this pandemic, or whatever the new normal is? Like, is this going to make a big difference? Is this age group is vaccinated, or is this just like another little step in the process? I just would love to hear your thoughts on those things.
Great, thank you. Dr. Relosa, do you want to take
Sure.
that to start with?
Yeah. So in terms of the difference between what we'd call natural immunity, right, from getting COVID and your immune system and becoming immune to it versus vaccine, to be honest with you, we don't absolutely know the answer to that question. We know that reinfection is rare, but can happen. And we know that, to kind of answer Kenesha's question, that even when you're vaccinated, that you can still get infected. And now, the important part, and maybe we should stress that vaccination in this instance is about getting severe disease, meaning ending up in the hospital or having morbidity, as Dr. Passy alluded to, or death. And that's really the thing that we are trying to prevent here, because that's how most vaccines work. They don't actually necessarily always work on the idea of you're not going to get infected, but in terms of having severe infection, or so people who are vaccinated can still get infected, but we know overwhelmingly they don't get hospitalized or die or have severe consequences. So because we don't absolutely know, to rely on, going back to Megan's question, to rely on the idea of, well, I had COVID and I should be fine, is probably not the best bet of what we should do, especially when we have a vaccine that is effective and is safe. And that's really what it is, what we're talking about. And again, Dr. Passy alluded to a lot about risk, and I don't know, for me, I would rather take the risk of very rare and usually mild effects from a vaccine to overwhelmingly assure myself of not getting severely infected, even if I had COVID from before.